Missing drowned, lost at sea is what he's been considered, but they never found his body. And I think that there is still one from Vietnam,
Okay.
still considered missing in action. All the rest of them are covered.
Any other questions? Alrighty, moving on to, thank you, Karen. Moving on to our Health and Human Services business, we have agenda item number 9, our HHS expenditure report.
Expenditures for this last month was $45,686.96, and this has approved them. They should be getting the checks cut as we speak. They weren't prepaid. Anybody reviewed? Did anybody have any questions about any of our expenditures? Jump out at anybody? Right.
Nobody's got any questions or concerns, we go for consent here, so I have a motion, correct? No motion? Okay.
Just for your review.
What about agenda item number 10 on 2023 HHS budget summary? Placement.
There's a budget summary is out there. But we should be at about 92% of utilization. We're at about 70% overall, but you probably see it, some of the units and programs are a little bit under. So overall, we're good. Our core budget balance after I do like anticipated revenue and things like that, we're looking at about 83,000 to the good. There has been a couple of unanticipated revenue sources. A late payment from income maintenance, the consortium. So that came in later in the year and it didn't get posted back. So that's sitting out there. ADRC finally got their $28,000 for their, because they went from a 4-county to a 3-county region. So there was some carryover contingency funds that got distributed. So that's kind of sitting out there. But yeah, otherwise I think it's looking pretty decent. I just saw the remit come in for our WIM payments that we get every year, but I don't, it's out there. I'm not exactly sure of the exact amount, so, but that's gonna be coming in and that always really, that'll change that number drastically.
And we still would have some charges yet out from like Winnebago or this institutional cost placement. Yes, that are gonna come in probably after the first of the year that we still.
Correct, yes.
This
Yes.
budget still.
Yes, and that'll affect the placement side of it there, so. But yeah, but the clerk's office has been really good about making that adjustment, that journal entry correction, so that it's the expense is in the placement fund where it should be, so they've been really good about staying on top of that, so there shouldn't be a big transfer at the end of the year.
Any other questions, concerns? Mr. Landuit?
I was wondering if you compare this year's budget to last year's, I understand.
Right, probably very similar. Yeah, very similar. Like I said, I think next month, once I get the WIMCR dollar amounts in there, it's gonna look. Last year we had about 400,000 when it finally got said and done, when I did a final report in February, March.
I think there were a lot more vacancies last year.
A lot of vacancies
So there-
last year.
I mean, we'll be okay with the budget, but we might not have as much to get back this year as we
Right,
did last year.
yes, exactly.
Because of that.
It sounded like we were pretty good. I was just wondering how we stood.
Yeah, yep.
Any other questions or concerns? Hearing none, we'll move on to our HHS contract monitoring report. Hey, Jamie?
It's basically out there for you guys to review if you have any questions.
There is one, if you look on page 5, that is over budget that we'll be working on and bringing back for next month. Other than that, things are looking good.
What's your on-call, is it for mental health crisis?
We go through Northwest Connection.
Yeah, how does that process work after hours?
So the call comes to them directly. So we have an MOU or an agreement with the sheriff's department, the PD, and the hospital. And they all know that all calls for after hours go to Northwest Connections, and then they take care of everything. If there needs to be a response between the hours of 5 p.m. and midnight, they don't go out. There is no mobile response from midnight to 8 a.m. But they
You wouldn't
will
have
do
staff
phone.
available for that either.
We don't know. There's only phone response. So they will talk over the phone. They will have those communications. They will make chapter in decisions. They just won't go out and do that face to face.
Do they bill per patient contact or?
I think how it's set up is per patient contact, but it's in bunches. So if you're between this amount of calls and this amount of
Yeah,
calls.
it's a flat rate.
Yeah.
Yeah, that we pay.
And they also take the calls from initially during the day, and then if mobile response is needed, they will call on us. And we do all the follow.
And we're able to fill those contacts that Northwest makes.
Yes, we bill for those. And we reach out to those patients that, before we send any kind of invoices or anything, we will reach out to those patients as well to let them know, hey, by the way, we're aware this happened. Can you, do you have any insurance information you can send us? And if not, we do invoice.
So that's if law enforcement gets involved, they go to the hospital for clearance and chapter, then you can bill that person back for the utilization of Northwest.
Do we get rich off it? No.
Any other questions or concerns with their contract monitoring report? All right, we move on to action items. Agenda item number 12 is approved HHS contracts, agreements, and amendments.
So we have two sets. One is for 2023 and the other is for 2024. So we'll start with 2023. The first contract we're looking to go into is Iris Health Clinic, Woods Crossing. We are looking for $1,800 to contract with them to provide AODA services for adults being served by the Behavioral Health Services Unit. And the second one is Sunshine and Giggles. We're looking for $9,500 to provide childcare services in order to fulfill safety plan implementation for children being served by the Child and Youth Services Unit.
These are totally new contracts?
These are totally brand new contracts.
So we need these individually, correct?
No,
No.
you can actually do them as a.
Any questions, concerns, motion to approve?
I move that we approve both contracts listed.
Motion by Cindy Chicker to move that we approve both contracts that have been presented. Is there a second?
I'll second.
Seconded by Supervisor Ranish. Any other discussion, concerns?
Is it already, there's some money available
So,
for
yes.
the budget?
Call for a vote. All those in favor signify by saying aye. Aye. Opposed, say nay. Motion carries. And item number 13, we have a 1224.
Okay. So this one is a brand new contract that we are going to be that we'd like to go into contract with. It's called Deep Root Consulting LLC. We are looking for $49,500 for them to provide psychotherapy, community skills development, and a variety of other services to CCS service consumers in our behavioral health services unit. The next one is Arneson Counseling. We do have a contract with them in 2023. We are looking to go into contract with them in 2024 for $49,500 to provide the psychotherapy, community skills development, and other services to CCS consumers in the behavioral health services unit. The next one is Music on the Move, Music Therapy Services, is a continuation from 2023. We are looking for $25,000 to provide counseling and therapeutic services for children enrolled in our Children's Long-Term Support Program. Soaring Skills, we are looking for $30,000 for them to provide daily living skills training for children also enrolled in our CLTS program. The last one is a new contract for 2024. It's Camping Experiences. We are requesting 11,000 to provide respite for children and families enrolled in our CLTS program.
So we heard 5 contracts. We got a motion by Supervisor Renish, seconded by Mr. Van Landijk.
Question. Are these contracts like a not to exceed?
Correct.
Okay.
And it doesn't mean we use that much. We just do up to that amount so that we have it if we need it. And I believe the majority of these, if not all of these, are either CCS or CLTS, which is just really pass through that we get reimbursement for on the expense, 100%.
We've dealt with these before, right? These are,
Some of them I think are brand new and some we have worked with before.
haven't assumed it was a carryover.
Yes. Yes.
Thank you.
I've not seen that music on the move music.
That's,
I know I've seen it, but I was saying in the past, like,
We've contracted them in 2023.
okay.
it's new to me.
Yes, yep.
Okay, any other discussion? Hearing none? I'm gonna call for a vote. All those in favor signify by saying aye. Aye. Opposed, say nay. Motion carries. Now we can go on to agenda item number 13, which is a request to obtain a county vehicle.
So it's my understanding that if, once the sheriff's department is done with their vehicles and they get a new one, they will put out to all departments that they have them available for us to be able to request to receive one of these vehicles. It has to be approved by this committee. So I am asking that I be given the authority to take one of the vehicles if we are so chosen for one of them. I don't know if there's more asks than vehicles, but I do want this committee's approval. We would really use these for our staff members to be doing home visits. As an example, our adult protective services worker has been doing her yearly Watts reviews. And since November 20th, she's put on 1,500 miles on her own vehicle. So it would be very nice if there was a vehicle available to her that she could use.
Mr. Chair,
Yeah.
can I chime in? Also, for liability reasons and liability purposes, there are certain times where it should really be required that they're using a county vehicle, because should someone do damage to one of the personal vehicles or be injured, or there are various things, it really would be wise. I know in my previous human services department, we mandated that any child protection visit be done in a county vehicle for those exact reasons. So that may be something to explore as we go down this path, if there is a vehicle available, that maybe priority be given to certain types of visits over others, and, determining how best to utilize the vehicle as well.
Mr. Barris?
So if we're chosen to get a vehicle, do you buy it? Do you give it to us, or
Given to us, just transferred from one
there's
to
no
another.
cost to it?
Well, I think the only cost would be the maintenance that would be coming out of the budget, our budget here, whatever that may happen to be.
The hope is that those expenses would be offset by the mileage reimbursement that we won't have to be paying.
So far, 2023, we've spent almost $40,000 in mileage reimbursement. So I'm guessing that it would not cost us $40,000 in maintenance. Not on my budget.
$40,000.
The first one we had.
That's not on, that's how many vehicles or people? is that?
I don't know how many people that is. I know it's 70,000 some miles that we've been putting on personal vehicles, so.
Interesting.
How does that show up, like on the public safety side on the sheriff's department? Normally they might get a trade-in value. Is it just kind of just disappear?
It's just transition from one budget to the next because it's paid for already,
Right.
it's already owned, it's a county owned, so it's
But-
just signed over.
Sheriff's giving up an asset. So
Correct,
it doesn't,
yeah.
there's a,
And that's, we've had that discussion, about, Josh maintains his kind of fleet, and there's a very specific way to determine the best point to be trading in vehicles or repurposing them. And that hasn't been done in the past, but we're looking at basically setting up a county fleet schedule. And that way we can determine when the best time is to get that maximum trade-in value. So that if something like this were to happen in the future, maybe, yes, the sheriff's office would trade to get a vehicle and get a credit, or maybe it would be transitioned to another department, or with mileage exceeding $40,000, is it wise to purchase and maintain a minivan, let's say, for that reasoning, and put that as part of the county fleet? So, these are things we've already kind of had discussions on about creating those efficiencies and making sure we're kind of getting the best bang for our buck, because I know typically like highway trucks at about the year 7 mark is 6 or 7 is when they're really no good anymore. So, there's a bunch of stuff to be taken into account. So Josh is working on that for his vehicles right now. And then I had asked him, let's sit down with Clay. Let's talk through then the sheriff's office vehicles too, and how do we determine that? And then if we have this type of a vehicle, I think we can start having that discussion as well. And I could see potential, savings and maximum benefit going
Well, and
forward.
with new vehicles, having a fleet myself for many years, the way things are now with electronics and stuff like that, repair costs are tremendous now. So you really need to factor in, yes, you need to keep a younger fleet.
Exactly, because as they get outdated, the nickeling and diming can almost be more
It'll eat you up.
than leasing or owning a newer vehicle. And that's
Just give
absolutely.
everything to HHS.
So that is something, and depending on what the vehicle is, that may be a fair question to ask. What have been the issues with it? What does it look like? Is it going to be wise to keep that vehicle? Would it be wise to trade that vehicle in for something else eventually in a year with the budget process? Those are all conversations we can have.
And when I was in Vernon County, their human services had a fleet of 4 vehicles. And for many, many years, I think they had them for the last 15, maybe 20, more than 20, 15 years, and they have found that it was beneficial. There was a cost savings to having their own vehicles versus doing mileage reimbursement. And it is a great benefit to employees. I look at this, Cindy putting that many miles in her car, she had to put new tires on because she got ran over a nail. And so there are those expenses that come with it that if they can.
I was in an organization where they handed the vehicles down twice, so we could take it from HHS and eventually everything would end up with Randy. How have I said that?
Okay, I'll pass that along. I'm sure you'll be thrilled.
There are times too where you transport, clients, let's say children, for instance, that you gotta remove them from the home. Transport that's done in a private vehicle right now, so this
Yes.
may be a little bit of a safer liability issue.
Yep.
For the person that's doing that, okay. So Rand Landite,
Question, how many home visitors do we have on board? Because you're asking for 1 car, right?
We are asking for 1 car, so it could be a.
So yes, that mileage not go away.
I think in our behavioral health unit, we have 5 that do home visits, and this is just off the top of my head, I think we have 5 that do home visits. We have 6 in children's that do home visits, and we have 3 in the ADRC that would do home visits. 5, 7. Yeah, and then public health, all 3 would.
That 1 car is going to get spread off. We
It
think.
really is. But I think like Candace talked about, if we set up different expectations, if you're going over 100 miles, you get precedence over somebody who's just going to Lone Rock and really starting to look at some of that stuff to maximize the usage.
How many vehicles are available from the sheriff's department that might be?
I think there's 3, and for whatever reason, I have it in my head that there are 4 departments that may want the 3. But I could be wrong on that.
Trying to think. I think you're right on the 3. I don't know that I've heard of all 4 departments.
Okay, so maybe it's just 3 and 3.
So, but we'll see.
Maybe we get,
It would be nice.
so maybe we get all 3.
There you go.
So for starts, I'd like to move that we do look into this and try to get it for HHS. If we do, fine. If we don't, but that will be for future discussion that we can decide what's to go. If not, maybe a car, maybe a van that she spoke of, because I think those might be more useful. But, budget wise and things, we need to kind of go through this. But for right now, I move that we go forward with this.
so motion by Mr. Lee Van Landite to obtain county vehicle from the Richland County Sheriff's Department office, not department, it's office.
Second.
Seconded by Dr. Barris. Any other discussion? I guess I want to say that probably would have the police package in it. I drove one of those, we have it at the fire station. I tell you what, that very light, hitting that gas pedal and you're flying. It's got some power to it.
Get to their visits faster.
Yes, have to have that in the policy. That will be on a policy. Version for speeding ticket.
Any other discussion on obtaining the vehicle from the sheriff's office? Hearing none, all those in favor signify by saying aye. Opposed? Motion carries. Agenda item number 14 is approve a leadership academy training.
Right, so I had connected with Southwest Wisconsin Technical College to look into doing leadership. Our leadership team. There we go. We would utilize ARPA funds. Our public health department has about $350,000 in ARPA funds that we have to use by the end of next year. Candace and I have talked and we've sent a long list to the state of our wish list and they've approved everything on our wish list that we could use those funds for them. There's obviously more wish list items than there are funds available, but this is something that I think would be very beneficial. HHS over the years has had a lot of turnover. We have a pretty stable staffing unit right now, but we also have some young managers. And so I think this would be very beneficial to the agency, to the longevity of the employees, if we can provide this leadership training to the staff. It is over 10,000 and that's why it's coming to you and then it'll have to get approved by full county board. But I've talked with my leadership team. There's 13 of them. Everybody has it on their calendars, is able to do this. And I do think this would be a great benefit to the agency. And so we're asking for your approval and then approval to take it on to full county board for their. There is no county levy that would fund this. Again, this would be using those ARPA funds.
I move.
Second.
Give you the vote.
Motion by Cindy Chicker to approve leadership training academy for some county of 13 staff members. Seconded by Supervisor Renish. Discussion.
This is something that I've been going to talk to you about. Some of the things that I hear from employees kind of dumbfounds me. I think this should potentially be a county-wide thing,
Agreed. Agreed.
okay?
We can be the
Because
guinea
we're-
pig then.
Yep,
and
that's
see
what
how
I
it
was kind of
goes.
see how it goes, because that was something I was gonna bring up in this discussion, is that if this works well, I've had several staff say, I'm not getting any training, or no one's preparing me to move up
Or
and take
just
on
for
additional.
leadership,
Right.
just,
Right, so I think this could potentially be a great way to not only help the leaders that we currently have in place, but our potential future leaders as well by doing that. And it shows employees that we value them, we want them to stay, we want to build them up, we want to grow them. And I think that's significant. I mean, I had
it's
an employee
not
come
like
to me.
thing, it's an annual, it's not.
Right. No, and I had an employee come to me because she wanted to attend a training course and it was $200 and she was told, we don't have the money. And I looked at her and I said, we will find you the money because this is important. And you should be able to go to this training. So,
And it's gotta be mandatory and it's like,
yep,
it's
No
just,
excuses.
it's just good business.
Yep,
It's-
absolutely, agreed. I love this idea and I was excited when Trish brought it. And so, yes.
And it's 9 weeks, 4 hours at a time, so it's manageable that we can work it into the schedule. There's one conflict, but I think we can just have that one worker appear by Zoom for that week. I just have to clear up with Southwest. But I've met with them and I'm very excited about this. I think
Is this
it'll-
on-site training, Trish? Or
Pardon me?
is this on-site training
Yeah,
or
they come
away?
to
or-
us. Yep, they come to us. So the majority of the meetings will be across the street. I had to do one in here because our conference room was reserved, but yeah, it's on site and they come.
And I can tell you the disc training and the strength finder training, I've done both several times. And it really is helpful in identifying ways in which you work together. It helps you relate to people better because you understand how they operate, how they think, what's important to them. It really, I think, helps build team. And it also lets you know who has a different perspective or way of doing things than you. So if you want to reach out and make sure you're covering all your bases, you can say, well, I know so-and-so was very different than I was. I should get their perspective on this. And it is extremely helpful in building team, I think.
Excited.
I've heard good things about this leadership training. Supervisor Williamson, I believe, attended this before, and he talked highly of his trainings.
And that's where I got the idea to reach out to them and to talk with them. It's from him.
We have a motion and a second. It's on the floor. Call for a vote. All those in favor signify by saying aye.
Aye.
Opposed, say nay. Motion carries. Agenda item number 15 is our director report. Tricia?
All right, so you saw the unit updates. I just wanted to highlight a few things in there. First off, I included a letter that we received on our home delivered meal program. And I just really wanted to share it with you to make sure everyone understands and remembers the value of our home delivered meal program. Somebody was having a stroke at the time that the meal was being delivered. They took immediate action, contacted the family, contacted 911, and potentially saved this person's life. And so this isn't what happens every single day, but it is a good example of the importance of the program. Our home delivered meal program has a lot of levy. The board approved a lot more going into this program of levy, so it was very much so appreciated for 2024. And I just want to bring to the attention the value of that program, not only about the meal, but about having those individual contacts with people that we serve. In the ADRC, our elder benefits specialist, just a few highlights, is going to be retiring in January. She has been with us 39 years, so that will be a great loss. That unit has had 2 significant losses, or through retirement, I shouldn't say losses, changes. Through retirement, Karen had many, many years of services, and so did Joanne. And so they were leaders in that unit. And, we know there's others that will step up and take their role. In our behavioral health, we do have an opening for our AODA counselor. And so we are in the process of advertising for that position. With our CCS program, we currently have 56 individuals enrolled in the program, and they're either enrolled or in process of being enrolled. We have 49 enrolled and 7 in process. And that's quite a few people that we're serving through that program. So that's wonderful. Just remember that is a Medicaid program and it's fully funded by Medicaid. In our economic support for individuals who are calling that are needing the elderly, blind, and disabled line, there is a really long wait. We have found that population isn't comfortable using the callback feature. So if you happen to hear of individuals who say I was online for a long time, they can utilize the callback feature. We'll give them a callback that day. So instead of waiting online, you can hit, a button to say, yep, I will take a call back. Just something to share with people in the community if you're hearing that that's an issue. I do have a meeting with the consortium tomorrow, and that is one of the items that's on there for discussion is those long waits. So we're hoping that there'll be some changes coming, but for now, please encourage people to use that callback feature. In public health, we do have our 140 review coming up in, I believe it is March. There's going to be a lot of work that's going to be put into that. And I know that Brandy will be reaching out to the board members, asking for their participation, or if they're interested, welcoming them to participate in that. I don't think that has happened in quite a while. I think during COVID years, they kind of gave a pass to different health departments. And so they're back really doing that deep dive into our programs to make sure that we are in compliance. And with public health also, Troy Morris has been our environmental health consultant for many years. It's been a 5-county consortium that is now going down to 3 counties. So those are duties that we are taking internally. He was here 1 day every other week, and now our public health specialists will be taking on those duties. And then I just want to, I guess at the end of the year, say a thanks to all our HHS staff, our leadership team, and our managers. It's been a good year. We have some phenomenal staff who are out there, who are willing to step up, help out, do what they need to do. We've got a couple of brand new managers in 2023, and they've been working very hard to learn their programs, retain staff. I look to Brandy And just want to give a special shout out to Brandy Anderson, who really was a unit of one for pretty much the whole year of 2023. I appreciate her sticking it out and still coming to work with a smile on her face, so that's appreciated. But there's also other staff members who have stepped up greatly in 2023. With Angie leaving, we had Megan, Stephanie, and Jamie really stepping up and taking on those duties. So it's really appreciated. And I know I'm not counting everybody who stepped up, but I do really appreciate that and want you guys to know it. And I want to, shout out to you guys too and let you know that I really appreciate your support this past year. It's been very, very beneficial and helpful, and it was a good year. So thank you.
Any questions for Director Clemens? All right, you want to just lead us into the organizational chart?
Can you do that?
Sure.
So the revised organizational chart should be in your packets for review. I think that this new format was given to you guys the last time that we reviewed this. There is a couple of things that you guys had wanted added. We did add a color coding system there. So you guys or a key so that you guys understand what the color coding system is. Pretty much the only changes that were made since the last time we reviewed this is there were some vacancies that have been filled. So the chart's been updated to include the new staff members who have taken on those positions. Two other big changes, just to note, if you're looking on the first page, we kind of show all the different positions in the agency and the number of positions that we have in each of those. Under the Aging and Disability Resource Center, the clerical assistant position went from 1.5 down to 1. We did have a part-time clerical assistant who was working in that unit that has taken a different position in our public health. And at this point, I don't believe we're gonna be refilling that. So that was reduced down to 1 position instead of 1.5. And then in our Child and Youth Services unit, we did have a leased family preservation worker that was approved the other night to become a county position. So that has been updated as well. Those are pretty much the big changes. So if anybody has any questions about that, the first page is obviously kind of a general overview of the entire agency, and then each unit is broken down in the subsequent pages. So.
And as always, we only have 3 openings right now.
Yes, we're looking to still fill our AODA counselor, ADRC specialist, and one of our child and youth services case managers. Those are all still in the process of being advertised, interviewed, and recruited for.
Any questions, concerns? It's good. All right, thank you for making that chart. It's nice. Anybody have any future agenda items? Let's bring forth to our next meeting.
Before we do, if I may, you gave us all accolades, and I think we owe you accolades too for what you've done and all of your staff, and you've done a wonderful job. Thank you for this past year.
Hearing no future agenda items for adjournment. Motion by Ms. Chickers, seconded by Supervisor Renish. All those in favor, signify by saying aye. Opposed? Thank you for coming today. Thank you for everybody that's online. Don, I did see you and recognize you.
Right me out with